Welcome to Let's Talk About Health, powered by Focus on Diabetes. Focus on Diabetes partners with accredited doctors to share education and new treatment options, world class healthcare organizations to introduce new technologies and free screenings for diabetic patients, their family, and the community. Now, let's talk about health.
Hi, welcome to Let's Talk About Health. My name is Tiffy Greer, and I have joining me tonight, Kelly Krall. Um, Here's a little bit of information about Kelly. Kelly Krall has over 30 years of experience in the medical case management field with a focus in nonprofit organizations. She's been a case manager at CAS, a division of Cedar Valley Hospice, for over 4 years, administering the Ryan White Part B program to people living with HIV in Northeast Iowa. Kelly's background includes work as a sexual abuse assault advocate, working alongside physicians in medical offices, as well as experience as a EMT and a massage therapist. I have also worked with Kelly. I work as a medical assistant with the infectious disease provider, Dr. Amy Patel. I am also a volunteer with Focus on Diabetes, have been since we started. So, welcome and let's talk about health with Kelly. So, Kelly, thanks for joining us.
Thanks for having me.
Awesome. So, can you tell me what CAS stands for and a little bit about what CAS is about and how it started?
Sure. CAS stands for Cedar AIDS Support System. We do HIV case management for people living with HIV. CAS started in 1988 when the AIDS epidemic was sweeping the nation. A small group of local citizens meeting to evaluate needs in our community. Cheryl Horner, the executive director of Cedar Valley Hospice at the time, volunteered to have the agency provide case management services, and this marked the beginning of CAS. And this year marks our 35th anniversary of having case management here through under the umbrella of Cedar Valley Hospice. When CAS began, the caseloads were small. They averaged 30 to 35 clients per case manager. Case managers now average 58 to 60 clients. One of the primary differences has been the development of antiretroviral medications in the mid 90s to treat HIV. Now, instead of a death sentence, HIV can be managed and people can live long, productive lives as long as they meet regularly with their doctors and take their medications as prescribed. We are funded by the Iowa Health and Human Services Ryan White Part B.
Okay. So typically, what counties do you serve here with the Northeast Iowa?
Well, we serve 15 counties, the same ones as hospice. Our clients, there are a few Ryan White Part B agencies spread throughout the state. I do have several clients that live in the Des Moines area that chose not to change their case management, which they don't have to, as long as they're living within the state. So then but they have to come to us for their required annual um, reassessment.
Okay. What all services do you guys provide?
We provide quite a bit. Case management, which is free and confidential. There is no cost for case management. We do have a benefits coordinator. She deals with insurance. Um, we do a basic needs and a grocery card monthly when requested. Emergency assistance for rent, mortgage, utilities, phone, eyeglasses. Funds are limited and must meet program guidelines. So there's some financial, you can only make a certain amount for certain
So I was gonna,
things.
um,
Health
keep going.
insurance, health insurance premiums and copays, and that is through the ADAP program. So when people come and if they make too much for Medicaid, then if their job um, provides health insurance, they can go through that. Or if their job does not provide, or it's extremely expensive, we all know how expensive insurance can be and how much it can take out of your check. We do have the ADAP program. ADAP stands for AIDS Drug Assistance Program. They pay co-pays. We can actually get people onto insurance, and then ADAP will make those premiums for them. Housing assistance we do, CAS funds to assist emergency short-term mortgage, rent, deposit, and or utilities. The amount varies depending on funds available, need, program guidelines. Medication copays. Sometimes when people aren't on ADAP and they're on Medicaid, sometimes paying that $10 copay or that $5 copay or something can be difficult. So we can help pay for those. Mental health counseling. I would encourage anybody that needed mental health counseling. Sometimes insurance doesn't pay for that. We do have a program that will assist in paying for that. Transportation reimbursement. So getting to the doctor, we try to just remove any barrier. We do bus passes. We can get taxis. Pretty much removing just any barrier to their health care. Because we all know if people aren't housed, who cares if you take your medication, right? If you can't get to the doctor, that kind of thing. So we just want to remove any barrier they have.
Okay, and that is awesome. So how often do you have to meet with your clients?
Well, it depends on their level of case management. We have 4 levels of case management. We have MOS, which is generally people that are over the income limit, which means they just make too much for any financial assistance from us. They can still get case management. We can still help, with other things other than anything financial. So we meet with them once a year. We have basic case management, which it's still meeting them with them once a year, but we do check in with them more frequently than that. Then there's non-medical case management, and that's every 3 months that we speak with them. And then medical case management, which is every month. We check in and check in, make sure everything's going okay.
Okay. What providers do you work with, either in the area or?
Well, we don't have a whole lot of providers that do HIV care. There is Dr. Amy Vitale, which you know very well. She's at Mercy One here in Waterloo.
Yeah.
The University of Iowa hospitals, they do come to Cedar Falls 2 half days a month and see our clients. And there's Dr. Crosera, who is up in the Mason City area. But
Okay.
that's it for our area. There's just not a whole lot.
Okay. How do you meet with your clients?
Well, usually just give them a call to set up a time. They can come here to the office. We can go to their home or a third party place, to just depending on where they're comfortable. And sometimes we meet them at the doctor's office.
Okay. And for you guys, how do you guys get your referrals?
We get referrals from the Iowa Department of Health. Sometimes your office, Tiffy, sometimes the University of Iowa, sometimes People's Clinic, sometimes private doctors, and sometimes clients just look us up and find us on our website.
Okay, that was going to be my next question. If you ever encountered, or if a client is not comfortable saying, hey, I want to meet with someone that can provide these services, what they would have to do to get a hold of you guys to be a part of the program.
Well, they can call Cedar Valley Hospice. We're housed underneath them. There is nothing on our building that says CAS or anything. Our phone number is 319-272-2437. You can find us on Cedar Valley Hospice's website too, and gives all the information on how to get a hold of us. You can email us at cvhospice.org.
Okay. So with HIV and the impact on our community and individual lives, can you tell us kind of a little bit about that? How it impacts our community and people? their lives?
I think there's a lot of stigma involved still with HIV. I think it's gotten better, but I still think that there's a lot of stigma. Um, so sometimes people, a lot of my clients don't want anybody to know their status. I wish that wasn't as much stigma as there currently is. Um, but like I said, we're free, confidential. Nobody has to know. Typically, when we meet with a client, um, I wear something plain. I don't wear any logos, nothing.
Okay. Because I was gonna be like, how do you approach new clients, whether it's a newly diagnosed person or somebody that may have had HIV but didn't know about the program? How would you approach that client?
I think you meet the client where they're at. So new diagnoses are usually very upset. Um, Sometimes they don't believe it. Sometimes it's people aren't ready to deal with something. So it's just really a case by case basis. Sometimes clients come and they were case managed in another state, and sometimes our case management may look a little bit different than the case management did in their state. So just finding out where they're at and what they need.
Okay. All right. Trying to think of some more questions here for you.
Well, I can give you a little, some little things. It used to be that they told women not to have babies if they had HIV, but women can have babies as long as they're in care and they're taking their medication. Less than 1% chance of transmission to the baby. We have had several clients that have had healthy, happy babies.
Okay.
Um, Even though people can live a long, healthy life, we were talking about stigma a little bit.
Mm-hmm.
It's challenging for clients, and that has led to leading to the need for more mental health treatment. I know that can be scarce sometimes in our communities, but we have a list and we work with, local therapists, and so we have lots of options for them if they choose
So
to
what
take
about, I
them.
guess, like numbers? Do you see increasing numbers, decreasing numbers now?
Um, for a while, when I first started, we would get 3 or 4 new people a year, and then for a while it was 2 or 3 people a month. So it kind of goes up and down. I think with PrEP out there, which if you go on to PrEP Iowa, um, people can get PrEP for free through PrEP Iowa. So I think that's helped, a lot, giving people other options than condoms. Um, but I say everyone should wear a condom. Um, um, but since you guys do focus on diabetes, you should know that people with HIV are more likely to have type 2 diabetes than people without HIV.
Wow.
There are multiple medications out there now. Most medications have 2 or 3 medications in them. In the 80s, it was a pile of medication that you took, and it was every 2 or 3 hours, and it was awful. But now, a lot of times, you get 3 medications in one pill, and it's once a day. They also have a shot out there now every 2 months. If we can get the insurance companies to pay for that, that'd be great. But right now, they're not. Um, I can kind of break down our caseloads. 23% of our clients are women. 25% of our clients are over the age of 60, which brings its own worries and stuff when you're looking at heart and kidney, all the stuff that can go as you get older. Um, 42% of our clients are Black, and 18% of our clients are foreign born,
Okay.
which means they were born in another country. And some of them speak English, some of them don't. So we do have language line and ways to communicate with them to meet their needs.
Okay. And if there's a client or anyone that you meet with and they don't have insurance, or people may just want to be tested, where can they or do that without having that problem or feeling like, oh, I don't have insurance, so I can't do this or I can't do that?
Sure. Well, the health department, Blackhawk County Health Department or the health department in your area. They do test for free. Um, and then if somebody is positive, then they typically will ask them if they will call us or ask the client themselves if that's something that they want. I've met with numerous people at the health department. Some people want services and some people don't. And it's fine to not want them at first and want them later, or have them and decide you don't want them.
Mhm.
And we just, where people are at is where we meet them.
Okay. What family support do you provide?
Family support? You mean, can a client bring their family?
Well,
Or like a client can come in and meet with us, and they can bring someone with them if they want. I have a couple of younger clients who brought their mothers in with them the first time they came in, or a friend or whoever they choose.
okay. So when you do meet with them, whether they by themselves or with family, do you kind of go into detail about things they should maybe be looking out for or watching out for?
As far as health wise,
Yeah, health wise or even emotionally or mentally.
okay, well, we kind of go over kind of a laundry list of things. Our goal is to get them in care as soon as possible, and get the medication. If they don't have insurance, like I talked about before, we have multiple avenues that we can go through to get them insurance. Nobody in our None of our clients go without insurance, so there's always an option somewhere for them. Um, and we go through mental health if they need mental health, and um, we certainly have referrals and stuff for that, and money to pay for those appointments if need be.
Okay. Can you tell us a little bit or kind of walk us through intake process?
Sure. So we meet with the client, wherever they choose to meet. Um, we get them put into our computer, um, and then there's basic questions that we ask. We usually set up an appointment with them, with us. If they don't have insurance, we work on that at the first meeting.
So is there any financial eligibility, say if somebody wants services, but they want to be a part of CAS, or is there anything that would be like, hey, no, we can't really do this or that?
The only requirement to be case managed by CAS is be living with HIV. It's the things that we provide under that, um, that some kind can be financially, due to your finance.
Dude, okay. Well, there are questions. Is anybody out there got any questions for us? Nobody?
I can tell you that our clients range in age. Our youngest right now being 18 and the oldest being 84.
So what other so with like with the percentages for people that have HIV, like with the 42% that are Black, and what was the other percentage for the non?
23% women, 25% of our clients are over the age of 60. 42 of our clients are Black, and 18 are foreign born.
Foreign born. Any like, well, are there any numbers for Hispanics or well, there's I guess it's foreign born or
Um,
Caucasian?
we do have different breakdowns. I would say that the majority of our clients are MSM clients,
MSM. What does that
men
mean?
men who have sex with men.
Oh, okay.
Some of our clients, they just come from all walks of life.
Do you guys go out and do a lot of community outreach, or will you be doing some community outreach here
Well,
soon?
we're starting to do some community outreach. We will in August be at Pride Fest, and so we will table there. If anybody has any questions or anything, will be there. Me and Sarah. There are actually three of us in the office. There's me. I've been there almost 4 years, and Sarah, who's been here almost a year, and Elizabeth, our lead, Elizabeth Wilson. She has been here for 22 plus years, so
Oh, that's
she
a
was
long
kind
time.
of here. Yeah, she's our guru. She knows just about anything you need to know.
Okay. Um, Well, um, trying to think here of some other questions that I can ask. Since you're doing the community outreach, are there any other programs or things that you guys do out here in the community? Or like if you're working with like the health department or people's clinic or anything like that? With
Um, Typically, when they call us, we'll go and meet with somebody there. You could kind of maybe say what it looks like for somebody when they first come into the doctor's office, because you see that side of it.
yeah, some not so happy. Some people just, not really grasping on to like, is this real? Is this true? So I try to work with everybody to help me get through all this too. So, but yeah, and then like, how often or how much should, or I can't say much, or how often should a person be tested? Because they always say get tested, know your status, like once a month, every 3 months, or every six
Well,
months.
everyone, everyone, no matter where you're at in your life, should be tested at least one time in their lifetime for HIV.
Okay.
I will go back a little bit. We have heterosexual clients. We have people that used to use IV drug, used to be IV drug users. I just don't want you to think it's all MSM clients. We have clients from all walks of life.
Okay. All right. And then I'm glad that you did mention PrEP, because not too many people even think about PrEP unless, oh, in a case where someone may have come into contact with someone and they decide to go get tested, and there's like, oh, negative, and then they'll start like a 30-day treatment and things like that. So do
And,
you ever get that question if you ever have a client that comes in with a partner?
mhm.
um
And we do discuss that with our clients, and especially if the partner is with them, we encourage PrEP usage. But if you're a single person and you're out there and you're single and you're living your best life and having fun out there, you should definitely look into PrEP.
okay.
I would say anybody that is out there, just, I would suggest anyone. Um,
So with using condoms or PrEP, are there any other preventative measures that people can take? I be thinking abstinence.
well, I think condom use, because we're not just talking about HIV, right?
Right.
There's lots of STIs out there.
Mm,
Some you can treat and some you can't.
true.
So, we have condoms here. If anybody needs them, feel free to stop by. I'll be more than happy to give you some.
Do you ever see any like combination sometimes, um it specifically, like with me, we may see like a HIV and maybe like a latent TB or Hep C. Do you guys ever come across that at all after
Oh,
a client has been diagnosed with HIV?
yes, yes. And actually, ADAP and stuff will help with hepatitis C treatments,
It's
and
good.
that medication, because that can be really expensive as well.
Very.
Um, we do see some latent TB. Um, oh, um, percentage of yeah, we have a question in there.
Oh yeah. So
Um,
the question was, she stated that 42% of Black people have HIV. Just curious to know what the percentage is for Caucasians.
I would say right now we're probably at about 30% are
30%.
Caucasian. Yep, yep.
But I guess the thing is, everybody should know to get tested and use protection.
Everyone, absolutely everyone should be tested once in their lifetime. I have been tested. Tiffy, have you been tested?
I have been tested a couple times. But
Okay,
that's, I
see?
mean, I have a yearly that I do every year,
Yeah.
and I get everything done. What's not included, what my insurance won't pay for, I figure out the way to pay for it myself.
That, or you can go to the health department.
Yeah.
They can do those tests
So
for
that
you.
was another question. So how do you, if is there ever, do you ever see any insurance issues when it comes to your HIV, well, your clients, whether they want to pay for this medication or if they're saying, hey, we're not going to do this right now? Because I know sometimes we get where no, we don't want to cover this drug, but we may cover something else.
Right. So sometimes then that's kind of in the doctor's hands as far as prior auths and all that stuff
Mhm.
go. But the ADAP program does have a MedAssist program there too. So sometimes when we're waiting for those PEAs to go through or anything, we can do the MedAssist where they'll pay for it while we're waiting for those things to come through.
And that way they don't have to go without taking their medication.
Right. We don't want anybody to go without taking their medication.
So do you still see where a lot of people are like, oh my gosh, I'm HIV positive. I'm not going to live long past this, with that stigmatism, even though we try to put it out there, like there are medications out here that you take your medication like you're supposed to, see your provider, see your case manager, and, get to undetected and just kind of take care of your health. So do you
Yep.
see a lot of that still?
Yes, we still see that. And it's just having those conversations and letting people know that they really can live a long, healthy life with HIV as long as they take their medications.
And what about relationships? Do you see where they kind of fall back and kind of, I don't, what kind of, I guess maybe go into like a depressive state?
Sometimes. And then we check in a little bit more, do a little bit more of what do you need and what can we do to assist you through this to get you where, you want to be or you need to be.
Okay. So after meeting with the intake, the first process, how often do you guys have to meet with your clients and then with them having to meet up with their providers as well?
Well, typically providers, once they're undetectable, which we all know undetectable means untransmittable, um, they're usually seen every 6 months with lab draws every 6 months. Our new diagnosis are typically seen about every 3 months until they become undetectable.
Okay. That's good. That's good. Questions? Where can someone find free condoms?
Well, you can get free condoms from the health department. You can come to the CAS office. We have condoms. Um, People's Clinic, I do believe, also does condoms. Tiffany, do you have condoms at your office?
We do not, but I am
Okay.
working on Mercy One. We got to run
Yep.
everything through everybody.
Yep.
So
Yep.
we are actually working on being able to provide condoms. I know that there is a website. I don't really have it handy with me right now, where you can actually go online and they will send you free condoms too.
Yes. Yep. And I don't have that information in front of me
I have
either.
a card with that information on it. I just like, because when
You
we were
come and see me at Pride Fest, and I will have that information for you.
there's another question there. Okay, so just let us know one more time before we do close how to get in contact with your services at CAS.
Okay. So our phone number is 319-272-2437. You can find our information on the Cedar Valley Hospice website, or you can email us at cas@cbhospice.org.
Awesome. I don't know if she's telling me to shut up and get off. um, and for me, because I do work with an infectious disease provider, Dr. Amy Patel at Mercy One Clinic. We're located at 2710 St. Francis Drive, Suite 300. We do see more than HIV. There's a lot of infectious stuff that are out and about, but not just HIV. If there's any type of infections, MRSA, just different things. And I do work with CAS and the 3 case managers they have, and also, you know what, Kelly, you guys might have to come to Focus on Diabetes too.
Yeah.
And we get you guys, and you guys do a booth and have that information out as well. So again, Focus on Diabetes is a program that we do every year in September, the first weekend in September after Labor Day weekend. So this year it'll be September 10th. No, I'm sorry, September 9th at the Waterloo Center for the Arts from 11 to 2. And I'm going to bring some of Dr. Patel's information too. So I got some cards and a little bit about her because we're here, right here in Waterloo. And we just like to be out and serve our community in any way that we can. Isn't that right, Kelly?
Absolutely. Thank you so
Um,
much for having me.
See, wait, don't log off yet. So you tell me one fun fact about you.
Um, One fun fact about me,
Yes,
I love what I do for a living. There you go.
we all do. All right, so we're 6:01, a minute off. Does anybody have any questions? If you are thinking of some or you want to write some down, you can always email uh, the link there for Cass if you want to know any more information about them. Um, so there's another one. Commercials seem to be trying to normalize HIV and make it seem like it's nothing to be too concerned about if you get it because of all the medications out there for HIV patients. Why aren't more commercials being shown that promote preventative measures instead? And what educational information um, is your organization giving to your clients to encourage behavior that would prevent them from spreading the disease to anyone else?
Okay, so we give preventative information as far as PrEP and condoms and stuff. Um, but people live their lives the way they live them, and we just accept people for who they are and where they're coming from, and we go from there.
We do the same thing in our office. We do let them know, like, hey, use protection, get tested. If you are seeing anybody, let them know. Take your medication every day. So, and then I do kind of see where, all the commercials that are coming out about the different HIV drugs. And, it used to be like, wear condoms, all this other stuff. Honestly, the world we live in and with insurance and insurance companies, it's a whole nother world out here.
There
And
are
then,
also PrEP commercials
yep,
out there as well.
yep. Do you guys see yourself in the future getting more out in the community and educating us and helping us to become more aware of where you can find help and resources?
Absolutely. We're looking forward to that. And I know the health department is out there at a lot of events as well. Um, but yes, if you have something you want us to come in and talk or whatever, please let us know. Get a hold of us. We'll come out.
I plan on tagging along with her too, so you'll see me out there too. Any other questions at all before I let her go? And Kelly, as always, thank you. Thank you for
Thank
being
you
a
so
part
much
of
for having
Let's
me.
Talk About Health. I love you guys. Y'all help me. Y'all like my second rock. So thank you. Thank you so much.
Thank you. Good night.
Anybody? No? Okay. Well, good night, Kelly. See
Good
you next
night.
time.
See ya. Thank you.